When women go to the hospital to give birth, they're given medicine to ease the pain of labor. An investigation finds these drugs prescribed by doctors are the same ones bringing child welfare authorities to their hospital rooms. The Marshall Project and Reveal found morphine, fentanyl, and other routine narcotics used during birth are putting some moms into custody disputes. Once a mother and their newborn test positive, hospital staff report the results to officials. A first-hand account from a New York mother says she temporarily lost custody of her kids due to a positive drug test, even with no previous history of abuse. She tells the news organization it was doctors who prescribed the fentanyl. Drug testing grew in popularity during the opioid epidemic, and according to the Marshall Project, surveillance of pregnant women has only continued once Roe v. Wade was overturned. Researchers said a 2022 study by Massachusetts General Hospital shows almost 91% of women given fentanyl in an epidural will test positive for the drug after the birth. And based on their findings, it should bring caution to doctors about assuming a patient's drug use. Other studies have shown moms can pass medications onto their babies, so oftentimes it doesn't immediately prove they are abusing drugs. The common test takes a sample of a woman's urine. Although cost-effective, the Marshall Project said it doesn't give a clear picture of when the drug was used. The investigation said protections aren't put in place for the mothers in these situations. Many hospitals don't double-check the results, and social workers aren't equipped to know what medication was administered during labor. False reports prompted a New England OBGYN to change his hospital's policies. He said, "The hospitals are at fault. The clinicians are at fault. Our policies are at fault." Earlier this year, Massachusetts' largest healthcare provider changed their approach. The new policy won't report mothers just because a newborn is born exposed to drugs, but rather on gathered evidence that proves abuse. New Mexico, Washington, and Colorado are among the states with revised laws that stop social workers from taking away infants that show no signs of abuse or neglect. Mandatory reporting laws in the U.S. protect doctors and nurses for making these reports regardless if they aren't accurate. 27 states require hospitals to contact child welfare to positive test. At least 35,000 babies were reported in 2022 for substance exposure. For Straight Arrow News, I'm Kara Rucker. For more stories like this, you can download our Straight Arrow News app or find us online at san.com.